This is the world we live in. It's care versus dollars. We have to have both, but we have to develop solutions that allow us to do that. So I'll throw it open to questions. I hope there was something in there that was surprising to you. I hope you know a little bit more about healthcare and it's a little bit more understandable now than it was, but it's a very complex system and there's a lot of stuff going on.
I understand Greenville's a very profitable hospital, but why would Vidant want to come to an area that has so many negatives as a whole?
Because
and
those
be a main player in the area.
Yeah, that's a great question. When you're the tertiary care center, meaning when you're the care center in the area where all the bad stuff comes, when you have a heart attack or other things like that, what you want to do is you are the payer of last resort for everybody. We know for many of these healthcare problems, if you can intervene earlier, the care is better, the outcomes are better, and the care overall is less expensive. So we know that if you get sick here in Hyde County tonight and you need health care, if you didn't have anything that was in Belhaven, and if you didn't have anything that was in Beaufort, you'd end up at Vidant Medical Center. So we try to get it close, but you can't have a hospital everywhere. 24/7, 365 is great, and the transport system that we have, but you want to make it as close as you possibly can. And there's a limit to where we can put them. Bless you.
So is the purpose of this meeting tonight, is it for you to explain to us poor, uneducated Hyde County folks who chose to live here and good cooks and put on a little weight, now that we can't have a hospital in Belhaven that we've managed to have for 65 years, but now because Vidant made a contract with us and promised to keep one open and promised to improve it, but now suddenly they decided that they no longer wish to do that.
That hospital is unsustainable, and we've turned that over. We've followed everything that we've been asked to do, and the mayor said that he wanted to pick up that hospital. As far as I know right now, the mayor has not talked to the group that owns that hospital, which is the Pantego Creek LLC. So that hospital now belongs to someone else. We've transferred that hospital. So if someone else wants to run that hospital, they're welcome to run that hospital.
And y'all step out of town and we can find a group to run the hospital?
We have already. We're gonna step out of there on 12/01 on July 1st. And if somebody's ready to take that hospital, but we've written letters to the mayor, we've written stuff for them to help them do that, and they've been completely unresponsive on that. So that's the mayor's issue now, to run that hospital. He said he would. He said he could do it. So you'll need to talk with him on July 1st.
What is all that in the media that we've been hearing today and yesterday evening about the LLC group, that they do not want to extend that deadline?
Well, the mayor, to my knowledge, the mayor has not talked with that LLC group from the first part of April when we signed the agreement with the mayor. And he knew that he needed to be negotiating with that group in order to assume responsibility for that hospital. And to my knowledge, from what I hear from that group, that they have not been contacted by the mayor at all.
I spoke to Rocky Jacobs today, who told me he was both a member of Pantego Creek LLC and the Vidant board.
He's a member of the Directors Council at the hospital there.
Okay, and we were just getting some food, but we happened to run into him on the way out. So obviously he has an interest in both sides of the equation. And I know that during the mediation with the Justice Department that Vidant represented that the LLC, Pantego Creek LLC, would go along with whatever agreement was made, right?
We represented that they were amenable to having conversations with the mayor.
Okay, so what Rocky told me was that it was costing you, Vidant, $2 million a month to keep the hospital open. And so the idea of extending anything behind, longer than July 1st in order to allow this coalition of public-private partnerships to keep the hospital going was just untenable for the Vidant side of his interest. And I was just wondering, is $2 million an accurate estimate?
It's probably about $350,000 a month. But we have an agreement with the mayor, a signed agreement with the mayor, that he would assume responsibility for that hospital on July 1st.
Okay, thank you.
My question is, the healthcare delivery in the Belhaven area is different today than it was at 6 months ago. When I call the office that I have been going to for most of my life, they tell me they only see a number of patients, a maximum number of patients a day. And it's about a third as the number of patients that used to be seen daily.
Oh, I don't know why they're doing that. Is it Dr. Boyette? Perhaps you can ask Dr. Boyette. Have you guys cut back your calendars?
There's more than meets the eye there. There's a whole different system operating now under the Vidant system as it was when I was in charge of the office. I saw any and everybody, worked in any and everybody, and tried to take care of a high number of patients in need in a medically underserved, economically deprived area. And of course, we do have financial problems in Belhaven and healthcare in general. The primary care hospitals, county hospitals are on the way out. We've got to have a new system of operation. But I do believe that Vidant could have done a better job in coming in and taking over the hospital and its management.
But have you cut, that wasn't my question. Have you cut back your calendar?
What?
Have you, her question was, have you cut back?
I haven't cut back my calendar. That's been arranged at the front desk.
Well, the physicians are in charge of their calendars, so I don't know. I don't know the answer to that. Dr. Boyette says he hasn't cut it back.
Thank you for being here, and I don't want this to turn into a Pungo District Hospital forum. This is for
just so to be clear, the Pungo District Hospital on July 1st is the responsibility of the mayor and the community group that they came and said they wanted that hospital. And so we said fine. So I would suggest that anything that you direct about keeping that hospital open should go to the mayor and that community group that said they wanted that hospital on July 1st, and ask them the questions why they haven't approached Pantego Creek LLC that's responsible for that hospital and that was responsible for that hospital from a contract that had been signed previously to any of the negotiations that took place in April.
Dr. Herman, could you explain to the group why Vidant has not honored their contract that they signed in the first place?
We have, sir, and we've been through that before.
I was in dozens of meetings, and we made a very fine contract with Vidant, but Vidant has not followed through with their contract in every area. It has been breached, and I think if you would read the contract, you would find that to be true.
I have read that contract, and you have read that contract, and the Pantego Creek LLC has read that contract. And the Pantego Creek LLC, which is the body that's responsible for that contract, has agreed that we have met our obligations under that contract.
So you have not met your obligations, and anybody with any knowledge of the circumstances know that you have brought up a terrible situation to our town and our community.
Entitled to your opinion. Thank you very much.
Be respectful of why we're here tonight. And
John, you had a question?
Dr. Herman's here to try to help the community, to help all of us, and to help lower costs and to explain health care to us. And it's not fair to do this. So let's keep the questions to what the presentation was about, please.
Other questions from Ocracoke? Other questions from Ocracoke? Okay, John.
What can you do to address the 55 and older group as far as your cutting costs and services?
There's several different things that we need to do. First of all, we have to take better care of ourselves when we are young. That can help push things out. The better care we take care of ourselves from a high blood pressure standpoint, from an obesity standpoint, from a diabetes standpoint, will make a tremendous difference. Across the United States, and Hyde County and eastern North Carolina isn't much different than a lot of other places, although there are some places that do it much, much better, is we haven't had the conversation with our families about what we want for end-of-life care. Everybody says that they want to die peacefully at home when their time comes, but very few people actually make that choice. Or when the choice becomes, the choice is mine, I need to let my family know for the time when I can't speak for myself. And so those are some of the things that we can do. We don't want to withhold care from people that can extend their lives, but we want to make sure that we're not providing care that's futile care. It's not extending but anyone's life, and it's just helping us suffer more at the end of our lives. So those are several things that I think we need to get done. There are model communities across the United States that have done this. There's a faith-based group, some Catholic nuns in La Crosse, Wisconsin, that started that conversation back in the 1980s. And that's a conversation that needs to start in the community before you're sick rather than in the hospital intensive care unit when you are sick. And by starting that conversation in the community, about 85% of patients who are admitted to the hospital in La Crosse and the surrounding counties have an end-of-life care plan. Patients have let their families know and their healthcare providers know what their preferences are towards the end of their lives. The statistics here in Eastern North Carolina are fewer than 25% of us have those end-of-life care plans here. So it's important that we let our families know what we want for the end of our lives so we don't get care that we don't want. It's futile and at very high expense.
Dr. Herman, one more question, please.
Sure.
Do you believe that people of eastern Beaufort and Hyde County are better off now without the Pungo District Hospital and the proposed primary care clinic that's supposed to come to Belhaven later on? Do you believe that people are better served health care-wise and also economically by the situation that was ongoing with the health care that was available in Pungo as compared with what you're proposing?
I believe that this is a sustainable proposal, that the hospital is not sustainable there, that the funding will not be available in the future for a hospital there. It's not available now. I'm certain that you've worked very, very closely with the mayor and have been on some of the other visits where you've gone to other healthcare providers and asked them whether it was sustainable. And I know the answers that you've gotten there. What you have right now with that hospital is not sustainable. The 24/7, 365 is a sustainable option for that community. So yes, I believe that they are better off rather than having the hospital close because it's not sustainable and having no healthcare services there. 24/7 by 365 is great healthcare service for that community.
They have 3 clinics.
I have answered your question.
Yeah, we have 3 clinics in Belhaven in addition to the hospital.
Yes, sir.
I just want to report to the folks here that we have received funding from Vidant's community benefit grants over the last 3 years, and we have tried to take advantage of that program, and we're very appreciative of the funding that we have received from Vidant. It has supported our telemedicine primary care program here. It has supported chronic disease self-management program that we have been working with the faith community, African American community. It has supported that. And we have also applied for some funding for this year, and we've been granted it, and very appreciative of that. And we will be taking you up on your offer of working with the community on wellness programs. That's something that the county manager and our department have been speaking about, is putting into effect, starting with the County of Hyde employees, and then spreading on out into other businesses here, workplace wellness programs. So we will be communicating with you.
Perfect. We look forward to that. Thank you.
If you don't mind, I also spoke to a member of the Pantego Creek LLC management team today, and this person said that the logic that the management team, the managers use to essentially block the partnership or the agreement that you made with the town government and the NAACP and the United States Department of Justice. The reason that they want to block that is because they fear that a few years down the road, the hospital will fail, and that the clinic that you offered to build would not be there because you would say, well, there's a hospital, so let's not build a clinic. And so then 3 years from now, they'd be left with nothing. And so I just wanted to ask you, is it still on the table that you would build the clinic if the LLC blocks the agreement that you made with the Justice Department and the NAACP? And secondly, does the contract say that 36 months from now, something changes in terms of the hours per day that that clinic is operational?
I don't know about the hours per day on that, but we are planning on building that clinic if the hospital doesn't continue.
Okay, thank you.
Thank you very much.
Thank you, Dr. Herman.